So, moving on from the contraindications and indications with ultrasound, this is kind of the review of the literature that we've put together for this presentation. So, first of all, there's no direct evidence that using ultrasound for altered membrane permeability increases protein synthesis, mast cell degranulation, growth factor production, uptake of calcium, and fibroblast mobility. Okay. There is conflicting evidence on whether or not pulse ultrasound, independent of heating, affects blood flow circulation. Growth of new blood vessels with the use of ultrasound is controversial. There is strong evidence supporting heating effects on muscle, tendon, and initiation of bone healing. There is, however, a lack of strong evidence for dosage for musculoskeletal injuries and phonophoresis. Good with that? Any questions so far?
No.
Good. Okay. So safety is very important when using these machines. Proper maintenance of the ultrasound machines, ensuring the patient has sensation and circulation in treatment area. It is important to check a patient's sensation, making sure that they have protective sensation, because if they are not feeling any sort of burning or like that, then they may not be able to tell you, and that could just further cause problems. Ensure ultrasound head is moving at all times. Want to keep the head moving, and it's also important to keep gel between the skin and the ultrasound head during the treatment, and not getting it all over the table, all over the area. Trying to keep it kind of centered or where you're treating. And then use extra caution around bony prominences. So, burn safety. So, follow guidelines, as previously stated, is key. Listen to your patients. That is also key. Listen to what they're saying. They know what's kind of going on with their own body. Monitor patient responses, as I said, and skin checks. Even after the ultrasound treatment, checking their skin, making sure it's okay. So, in summary, evidence-based practice, evidence. Trying to keep up with evidence is key. There's new ultrasound machines coming out all the time, so it's important to kind of see what's working, what's not working, what may be working best. Indications, when to use ultrasound, when may it work best. Contraindications, what are some conditions, and as we discussed previous, what are the conditions that they may not be safe to use them. Looking for that in like a medical chart or the patient's history, listening for those kind of contraindications. Knowing the correct parameters is important, so using the correct megahertz and frequencies, knowing the kind of cycle you want it on, all of that is important to improve your patient. And safety, again, burn safety is important. That's where we could get into some trouble. Doing skin checks, making sure the patient has proper sensation while we're doing the treatments. Is there any questions about this? Yes.
So, I might have missed this. Do we keep the ultrasound head in the same spot?
That's a good question. No, you actually want to move it at about 4 centimeters per second, right around the treatment area, making sure it's on the gel, keeping that head between the gel and the treatment surface. That's a good question.
Another question.
Oh, yes.
So I've heard of patients feeling a burning sensation. What could that mean?
Ooh. Well, a burning or kind of like prickling sensation maybe, that may need to go to maintenance. When you hear somebody feeling like a really bad burn or kind of like a pringling coming out of the ultrasound head, that could definitely be something that maintenance needs to check out, make sure the ultrasound machine, nothing's broke with it. Yes?
So does ultrasound work the same with bone and other tissues?
Excellent question. No, actually it does not. Bone kind of reflects the ultrasound wave more and increases the heat around the tissues almost double as much as other tissues or tendons actually do. Do you have any questions? Talk later. All right, thank you guys. we are going to demonstrate the ultrasound machine. So, first thing to do, turn it on back here, just a simple power switch back here. What's good about these newer machines is you got the screen right here. Everything is kind of preset on here, so a lot of it is just knowing what buttons to click and knowing what the parameters are that the therapist has set. So first thing, there's going to be a screen that pops up, all these different options to choose from. We're going to go ahead and click the ultrasound button here. Okay. And now this is where we set up the protocol. So we're going to go to edit. For the settings, there's a green screen on there that shows the original settings, but now we have frequency. So as we talked about, the depth of the wave. So you can just clicking the button changes that setting. We got between 1 and 3.3. As we talked about, 3.3 megahertz for more superficial structures, and then 1.0 for the deeper tissues or whatnot. The duty cycle here. So the on and off cycle changes between 10, 20, 50, and 100, whatever is set at. We just click the button and change it. And then we have the intensity here. The intensity can just be changed based on spinning this dial to whatever it's set at. As we talked about, with only 0.5 watts per centimeter squared, it's going to take forever to heat up. So we usually stay away from that setting. So just be aware of that. And then the next important thing is the treatment time here. So you go ahead and click this button here, treatment time, up or down, whatever it may be. And then when you're ready, just go ahead and click that middle arrow. So we'll just keep it as it is right now. So can I have a volunteer to?
I'll volunteer.
Okay, perfect. Where do you want me to demonstrate at?
My ankle's been bothering me.
Okay. Oh, perfect. You showed up to work with only one shoe today. So, another cool feature of this is they have a cool little smaller ultrasound head. It's just stashed away in this little drawer here. And this can be used for smaller areas, trying to keep that treatment area. Usually only want like 1.5 times the size of the ultrasound head here for the treatment area. So because we're going to be on such a small area here right below the lateral malleolus, then we'll go ahead and switch this to the smaller one. Cool little feature. So we just go ahead and pop this off here, and it's just a quick switch of the for time's sake, we're just going to go ahead and leave that there. Probably going to have to get maintenance to check that out. Alrighty. We got the settings, it's kind of displayed here. So we'll go to whatever settings it may be that your therapist shows. Go ahead and put some ultrasound gel on the head there. And then once we get it moving,
Ooh, it's cold.
it's gonna be a little cold, sorry about that. Just go ahead and start. And the timing starts, and just go for the time. Trying to keep that gel in one area, like we've talked about in the presentation. For only moving that ultrasound head about 4 centimeters per second, keeping it moving, kind of really focus it in on that treatment area. Make sure that if you're going to pick the ultrasound head up off of the gel, that you would pause the machine first. And then you just kind of ask your patient to keep you posted on what they're feeling, if they're feeling any burning sensations that are painful, how it feels. So yeah, sounds good.
Yeah.
So
Thank you.
go ahead and pause that. So now we're gonna have my friend Pringles is going to demonstrate the older ultrasound machine. He's very good at it too. So he's very trained as well. Pringles if you want to show them the ultrasound.